Hi, everyone. Thanks so much for sticking with me. I really appreciate it. Some technological issues, but we got it figured out sort of. Just switched over to a new webinar, and we'll definitely get to the bottom of what happened there so we don't run into that problem again in the future. But I really appreciate you guys hanging in there. I know we're getting a late start today. If you have to jump off this webinar to attend to other things in your practice, that's okay. It is going to be recorded, so you can watch it later on your own time if we run out of time today. But my name is Morgan. Dr. Edmondson, thanks so much for being here today. We are having a lunch and learn, and we're going to be talking about heart rate variability. Before I get all the way into this, I do want to make sure you can hear me now that our audio should be working. So if you can just type into your question box. I think some of you know where that is already because you were letting me know before you were having some audio difficulties. Perfect, you can hear me. All right, so we will get started with talking about heart rate variability. So I wanted to kind of preface today's talk with this concept that's really physiological coherence. And when I think about coherence, it really comes down to the brain's ability to synchronize its own electrical activity. And that's really the key to all of our higher level functions. So in psychophysiology research, the field has kind of shifted towards focusing on this synchronized activity between different systems and even within systems. And we're focused on that synchronized activity really more so than the amount of a certain activity. Now, the amount of activity is still quite relevant, but this idea of synchronization is becoming more of a key concept. So this synchronization is really leading towards the idea and concept of coherence and physiological coherence. Now, this is a broad term that was introduced back in the early 90s, and it's just describing physiological phenomena that are functioning with a more ordered and harmonious interaction. So increased coherence or enhanced cooperative communication can occur between systems or within systems. And a great example is that we can have increased coherence between our emotional and cognitive systems, or if we're talking strictly physiologically, it could be an increased coherence between blood pressure and respiratory and heart rate control systems. So today we're going to be talking about coherence between the brain and the heart and kind of how all of that relates to specifically the autonomic nervous system. So we're talking about the autonomic nervous system today. It's one of those great systems that it functions automatically. We don't really think about it quite often, but especially in a primary care and even specialty settings, oftentimes we're seeing patients that the root of their symptoms is autonomic nervous system dysfunction to some degree. It's really highly related to stress and anxiety, even depression, things ranging from asthma to irritable bowel syndrome. And it's really innervated between the body and the brain. So of course, we've been taught there are two different sides to the autonomic nervous system, sympathetic and parasympathetic. Sympathetic, of course, is our fight-flight response. The pupils will dilate, we stop digestion processes, we're secreting adrenaline and speeding up the heartbeat, things like that, getting ready for action, really mobilizing the body. The brain is signaling to the body, let's get ready to go. We're going to fight or flee, and we're going to interact with whatever the environment has put forward to us so our body is ready. It's mobilized for action. Now, on the converse side of this is the parasympathetic system, the rest digest system. So in this is usually our normal state. So our heartbeat is slowed down, we're in more of a relaxed state, our focus is on conserving energy, breaking down nutrients, digestion, etc. And when we have changes from sympathetic to parasympathetic, it's essentially always a signal to both of these systems. It's never really one in isolation. It's always a give and take of both. And these systems work in high coherence. And it's the body communicating with the brain that is also working in high coherence. Now, I want to point out that on this graph, on the slide, the heart is in the center of this image. And really the heart is in the center when you think about this theoretically as well. And the reason why we care so much about the heart when we're talking about the autonomic nervous system is because it's innervated by both parts of the ANS, the sympathetic and the parasympathetic. So this means the heart really is reflecting changes that occur in either branch, either increased or decreased activity. So it provides us a unique window to see what the dynamics are that are occurring within the autonomic nervous system. Because without the heart and looking at the heart, we have a difficult time really objectively measuring the ANS. So the heart's kind of our go-to in terms of measuring this huge effect on stress and anxiety and this huge impact on brain and higher cognitive function as well. Now I bring up the brain because there is a true heart-brain communication that goes on within the bodies. So by definition, and stemming back, I don't know, early 1800s, the autonomic nervous system is considered an efferent or descending system. In other words, signals would originate in the brain and flow downward to the heart and body. However, these days, it's widely accepted that this definition is false. There's also body back and heart back to brain communication. And there's actually quite a lot of these afferent or ascending signals present. So the heart is in continuous communication with the brain and body, and that occurs through multiple pathways. Happens biophysically, for example, blood pressure, biochemically, hormone production. We know that the heart is secreting just a ton of oxytocin and communicating with the brain that way. And of course, neurologically, and that's really primarily what we're going to be talking about today is the neurological communication between the heart and the brain. And the primary means of this is something called heart rate variability, which of course is the subject of today's talk. Now, I want to talk about the heart and how it really has its own complex nervous system, which can be thought of as the heart brain. It has its own autorhythmic, it is an autorhythmic organ. So it's beating on its own. There are true pacemaker cells in the heart that initiate the cardiac cycle. And as far as I know, it's the only organ that true pacemaker cells have been identified in. They certainly haven't been identified in the brain yet, for example. And so this heart intrinsic nervous system communicates with the brain. In fact, the heart sends more information to the brain than the brain sends to the heart. I'm going to draw your attention to the right side of the screen here. Parasympathetic activity in this blue signal is actually communicating about 90% of nerve fibers in this parasympathetic system are afferent or ascending. And that's really stemming primarily from the vagal system, the primary nerve of the parasympathetic nervous system. And so 90% of the nerves in the vagus system carry signals from the body to the brain. Now, the highest ratio of where those nerves are coming from is the heart. So the heart is actually sending more signals to the brain than the brain sends to the heart in the parasympathetic nervous system. And those signals reach all the way up to the cortex. They're not just stopping at the medulla or even subcortical areas. They affect higher level cognitive functioning. Now, on the sympathetic side, there's also a bit of give and take. Less afferent signals on the sympathetic side, more efferent, so more descending, hence the thicker red arrow, but still about 20% of afferent signals exist on the sympathetic side. So still a lot of brain-heart communication. And again, they reach all the way up to the cortex. So signals from the heart especially affect brain centers involving strategic thinking, self-regulation, effective communication, and so on. So you can think about it as the brain really obeying signals sent by the heart, and thereby the heart can affect our perception. These signals cascade all the way up and modulate frontal cortical activity. So this heart-brain communication, well, the heart not only gives us insight to the autonomic nervous system, we care about that though, because it's this heart-brain communication, this higher level of cognitive functioning that can be impacted in our patients. So that's why we're really investigating the heart, even though Evoke Neuroscience is grounded in neuroscience. Usually we're on these calls and webinars talking about the brain and different electrophysiology biomarkers of the brain. here we're talking about the heart because it is very integrated in brain function. All right, so talking about heart rhythm patterns is kind of where we're headed today. And the reason why is that underlying the experience of different emotional states, there's a distinct physiology that's directly involved. So actually, sustained positive emotions like appreciation, care, and compassion generate a smooth sine-like wave pattern that's shown on the bottom here. And that's revealed within the heart's rhythm. And what this does is increases higher order, higher level control systems in the brain. It's increasing synchronization between the two branches of the autonomic nervous system, so parasympathetic and sympathetic working in harmony. And it is a general shift in autonomic balance towards increased parasympathetic activity. Generally, we see patients with increased sympathetic activity. They're stressed out, they're not doing well. And so this shift toward parasympathetic activity is getting us to a balanced state. Now, in comparison, more negative emotional states like frustration, anger, etc., are kind of revealed in a chaotic heart rhythm. So we're really interested in looking at these heart rhythm patterns, not only as they relate to emotions, but also as they relate to higher order cognitive functions. So how can we analyze heart rhythm patterns? Well, the main thing we're doing is looking at heart rate variability. Now, heart rate variability is the synchronized electrical activity between the brain and the body. And it's all of this synchronicity, this coherence that is underlying our ability to perceive, feel, focus, learn, all of those great higher order, higher level things that humans can do. So we know that the heart is intricately involved in the sympathetic and the parasympathetic system. So measuring different metrics from the heart can give us insight to these systems. And the metrics that we're going to be talking about is heart rate variability. It's a measure of neurocardiac function that reflects heart-brain interactions and autonomic nervous system dynamics. So looking at this in graphical form, heart rate variability, abbreviated HRV, is just looking at the heart rate on a beat-to-beat interval. So here on the x-axis, we have time in seconds, and on the y-axis, we have heart rate. So in red, you have your normal PQRS waveform. And when you average out heart rates, it's an average. We're looking at the heart rate across a period of time. But if you look at each heart rate individually, the heart rate for that moment in time, for that second, changes. So here we're starting off at around 60 and we're getting higher, 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 all the way up almost to 90, and then it drops back down. And then it's going to increase, and it's creating this sine wave, and that's our heart rate variability. So here in the EBOX reports, the comprehensive report, you might have seen these graphs before. We're giving you a sample of the cardiac waveform, and we're also giving you a sample of the heart rate variability waveform. So what we're essentially looking at is all of these time segments between each waveform, between each R to R peak. And then we're graphing it according to time. So it's a variability between each heartbeat. And ideally, we would like to see that large sine wave rather than a short chaotic wave, because we know those sine waves are increasing cognitive capacity, doing all of these great things, balancing the autonomic nervous system. All right, so how can we objectively look at this? The thing that might come to mind first is, of course, within a time domain. So how much variability exists in those heart beat-to-beat intervals? Now, if you've attended these webinars in the past, and if we've talked about heart rate variability as a biomarker for different disease states, you should know that heart rate is, or the heart is not a metronome. It doesn't beat each individual time the same exact way. It's actually erratic. And a healthy nervous system responds in real time to what the body needs. So that means an ideal heart rate variability is high. If your heart can last 1 extra millisecond before pumping again, it's going to do so. And then when it needs to pump really fast and get your body ready for something, it can do so. So we're looking for a high heart rate variability. Now, one time domain metric of heart rate variability is the standard deviation of end-to-end intervals in milliseconds. And that's what the EVOX reports are reporting. In the literature, there are other time metrics that can be considered, but generally they're all looking and just measuring how much variability is there between each heartbeat. Now, when it comes to heart rate variability, it's kind of a Goldilocks rule of thumb. Too much heart rate variability is not good. It can be indicative of arrhythmias. It really is just representing nervous system that's in chaos. It's poor physiological function, and it's poor energy utilization as well. So we definitely don't want too high of a heart rate variability. And we also don't want too little heart rate variability. Generally, too little heart rate variability is meaning age-related system depletion. It's a great measure of physiological aging as opposed to chronological aging. It can represent chronic stress. It can represent pathology of different disease states. And really, it's just representing inadequate functioning of the autonomic nervous system, and hence inadequate functioning of the central nervous system, because we know that the heart is sending signals up to the brain, and it does affect central nervous system functioning. So really what we're looking for is this optimal level, this Goldilocks level of heart rate variability. And when you find that, what it is representing is healthy function and inherent self-regulatory capacity, adaptability, and resilience. So a body that can fluctuate easily between sympathetic and parasympathetic functioning, that is ready to interact with the environment in a sufficient and efficient energy utilization way, can adapt, and can be resilient to different stressors going on. So that is our time domain, and SDNN is something that we're going to be talking about later when it comes to EVOX reports. Now, there's another way to look at heart rate variability, and that's the frequency domain. And that's really asking, what are the underlying rhythms in heartbeat to beat intervals? So it's not just the time we care about, the variability on a time metric. It's what the rhythms look like. Remember the difference between that appreciation waveform versus the frustration waveform. Those actually had the same variability according to time, but they looked so different, and we're really looking for that smooth sine-like wave. So just like the brain, we talk all the time about frequencies in the brain. Well, the heart beats and rhythms, and those can be graphed according to frequency. So here in this top bar, we're getting an original waveform from the heart rate as it beats. Now we can use algorithms to filter these out and tease apart very low frequencies, medium speed frequencies, and then high frequencies, abbreviated VLF for very low frequency, LF low frequency, and HF high frequency. Now the reason why we care about filtering out this original waveform and breaking it down into these subcomponents is because each rhythm is related to a physiologic process. So tons of research has shown that activity in the VLF range is representative of sympathetic arousal, whereas activity in the high frequency range is representative of parasympathetic arousal. And then in the middle, you have balanced autonomic arousal, where you can shift easily between sympathetic and parasympathetic, and that's really where we want to be. So then we have to ask ourselves, how much power does each underlying rhythm have? Now, power is like measuring how much of an HRV frequency is present. So here on the x-axis, we have frequencies. Remember our bins. In red, we have our very low frequency, green is our low frequency, and blue is our high frequency. And on the y-axis, we have power. So how much of these frequencies are present? Now here we have a lot of sympathetic activity going on. We also have a lot of parasympathetic activity going on, and we have hardly any balanced activity. Now, ideally, we would like to see the low frequency power as the highest number present, meaning most of our power is centered in that balanced frequency band. Now, we can also consider total power, which is the combined power across all three frequency bands. It's basically revealing vagal tone, vagal activity. Generally, the higher the total power, the better. So when we look at EVOX reports, this is an example of a summary report, couple biomarkers that we're looking at. Now we know what they are. Within our heart metrics domain, we have heart rate, of course, beats per minute. We also have SDNN. Now, instead of heart rate, we're looking at heart rate variability. It's a number. It's representing how much variability there is between each beat. And notice our reference range, we do have a cap on that. 150, that's a very high heart rate variability. Certainly past that, you should be concerned with things like arrhythmias, overall heart health, and investigate that. Now, usually we're seeing patients on the low end of this reference range, and that's meaning very poor heart health, perhaps biomarkers of myocardial infarct risk, things like that. We're going to get into kind of what these biomarkers mean for different types of patients, how they're used clinically. Then we have total power, vagal activity. Of course, we want to see higher total power, so low total power is concerning. And then we break down total power into sympathetic, balance, and parasympathetic domains. Sympathetic meaning somebody is just shifted toward that fight-flight mode all the time. Parasympathetic meaning they're probably lethargic, they're stuck in rest digest. Really where we want to see them is most of the power in that balance zone. Okay, so getting now into some of the applications of HRV analysis, I'm going to talk about a couple generally, but I do note that this is not an exhaustive list by any means. These are just some big ways in which HRV is used commonly in clinical medicine. So the first step is to determine the relative balance between the sympathetic and parasympathetic nervous systems, kind of what we just talked about regarding that sympathetic, parasympathetic, and balanced breakdown of total power. This can be really helpful to note if somebody comes in with anxiety and stress, and really it's not their brain that is creating these signals, it's originating from the heart sometimes. So correcting that parasympathetic dominance, that sympathetic dominance, that sympathetic overdrive can then correct the behavior that are happening because of that heart to brain communication. Now, HRV can also be used to predict an increased risk of sudden cardiac death and all-cause mortality, just an L there. This is really the original way that heart rate variability was studied. And if there were one heart-based biomarker to rule them all, heart rate variability would be it, because it is such a high correlation to heart attack risk and things like that. So commonly used in cardiology to predict cardiac health. Now, it can also be used to indicate fitness levels. So if you're a physician that works often with elite athletes, this is a great metric to assess if overtraining has occurred, to kind of dictate with your athletes when they can push it on days and when they need to kind of hold back on days, things like that. And then it can also be used to indicate nervous system aging rate. So this is one of my favorite applications. We have the largest variability of heart rate variability when we're young. And there's a significant drop in variability as we age. Usually about every 2 years, we can detect a drop based on age. And using heart rate variability, we now have a way to determine physiological aging of the nervous system as opposed to chronological aging. Now, this is a great study cited here that established normal values from ages 9 to 99. So it's a great reference tool to use of you have a 55-year-old patient, but they're coming in and their nervous system is aged like a 70-year-old patient. So it's a fantastic tool to assess the age of the nervous system. And we do that, it's heart, but it is heart-brain communication that's indicating overall cognitive function, autonomic nervous system balance, all those great things that are reflected usually in symptoms that your patient is coming in with. So great tool for basically physiological aging. Okay, so getting just quickly into some applications to specific patient types. First, I'm going to talk about heart rate variability and depression. So in this study, they were looking at a group of patients with major depressive disorder and a group of healthy controls. And they were looking at that intrabeat interval between R to R peaks. And they saw that patients with major depressive disorder had a reduction in heart rate variability. So, and this has been really widely studied. Heart rate variability is a psychophysiological biomarker of major depressive disorder. And it's so present to the point that major depressive disorder patients have reduced heart rate variability that's equivalent to those that have just had cardiac neuropathy, those that just had a heart transplant. So in this study, they were looking at patients with major depressive disorder, those that had just, patients that had just had a heart transplant, and then healthy controls. And there's a difference in heart rate variability between our depressed patients and our controls and our heart transplant patients and our controls, but there's no difference between depressed patients and patients with cardiac neuropathy. So it's really depressed in depressed patients. Now, I also want to note that the high frequency power, so remember high frequency HF is representing parasympathetic activity. So this parasympathetic activity is also reduced in patients with depression. So, and really this kind of feeds into a reduction of total power, and it's stemming from this reduction in parasympathetic activity, which is not what we want to see. Usually we want to see more parasympathetic activity, especially compared to sympathetic activity. We'd like to see a balance between the two. And here our depressed patients just have a reduction in that parasympathetic activity. Now, I do want to note that antidepressants don't increase or decrease heart rate variability. The exception is, of course, tricyclic antidepressant, TCAs. They block parasympathetic innervation to the heart, and they diminish heart rate variability. So something to use with caution if you do have a depressed patient. It's important to assess heart rate variability, assess the health of the autonomic nervous system, because putting somebody on TCAs that already has a reduced heart rate variability, that's already shifted towards sympathetic dominance and doesn't have enough of that parasympathetic activity, can actually make symptoms worse and can be very detrimental to their health. So use TCAs with caution. Note that they can affect heart rate variability. So the key takeaway here is that SDNN and parasympathetic power are reduced in depressed patients. So we know, and it's been well studied, that heart rate variability is a great psychophysiological biomarker of major depressive disorder. So moving on now to talk about heart rate variability and TBI, traumatic brain injury. There was a study looking at a group of concussed patients versus controls, and I want to note that there's quite a large range in these concussed patients. It was those with mild TBI ranging from 5 to 43 months post-injury, so a very large span of time. But nevertheless, when they were looking at heart rate variability on a time domain metric, here it's not SDNN, it's RMSSD, which is just another way of looking at that variability between R to R peaks. And they saw that heart rate variability was reduced in those concussed patients. And they also saw that there was sympathetic dominance in those concussed patients. So here they were looking at the sympathetic to parasympathetic power ratio. Ideally, we would like to see somewhere around 1, right? That would mean you're balanced between both sides of the autonomic nervous system. But here in the concussed patients, they had activity shifted toward that sympathetic overdrive, sympathetic activity, meaning their system is entirely stressed out. They're not recovering. They're not resilient to any environmental stimuli that's happening. And it's probably affecting higher level cognitive functions as well, which we often see after concussion. And patients can come in after a concussion, maybe even after a motor vehicle accident, really just having no idea or no concept that their memory loss or their mood changes, their mood swings could be related to a car accident that they had months or even years ago. but we do see that oftentimes this sympathetic dominance occurs, a reduced heart rate variability, and that in and of itself can be causing these central nervous system changes and behavioral symptoms. So the key takeaway here, SCNN is reduced and sympathetic activity is increased after traumatic brain injury. Now, sometimes this can recover on its own. There's spontaneous recovery after TBI. Hopefully a person would get back to an equilibrium, back into that coherent state of systems functioning together. But that's not always the case, at which point it's a great intervention opportunity to correct this heart rate variability, get it trained back up to where it should be, and then oftentimes we do see those symptoms resolve. Okay, now talking about heart rate variability and PTSD. If you attended the PTSD talk way back last year, you might recognize this graph, which is from a meta-analysis. Really great study if you work with PTSD patients. Strongly recommend it. Essentially, what this table is summarizing is that there's a reduced power in the high frequency band, so reduced parasympathetic activity for PTSD patients relative to controls. That makes sense. PTSD patients just aren't capable of hanging out in that rest digest mode. There's an increase in that low frequency to high frequency ratio, meaning not only is their parasympathetic activity reduced, but their sympathetic activity is increased. So it's twofold. Not enough rest digest and way too much fight flight. And we also see a reduction in the time domain of heart rate variability in reduced SCNN. So key takeaway here is essentially all the heart metrics you're looking at for heart rate variability. There's more than just shown on this graph in this table are affected in PTSD patients. PTSD is one of those things that is highly affected or highly related to autonomic nervous system function and balance. And really the imbalance of the autonomic nervous system plays a big part in a lot of the symptoms that PTSD patients are experiencing. So it's no surprise that looking at the heart and heart rate variability, you see a ton of biomarkers that pop up as significant in these patient populations. Okay, and then wrapping it up about heart rate variability and mild cognitive impairment. So if you pay attention to the newsletters that we send out once a month from Evoke, you might have seen a little snippet of this study. It's a brand new study that was published, I think, just a couple months ago. And it was a retrospective study that asked if they could identify mild cognitive impairment patients and really use heart rate variability metrics to distinguish a dementia with Lewy body group from an Alzheimer's disease group. So retrospectively, they looked at these patients, MCI, who also happened to undergo heart rate variability testing at baseline, and then later on developed probable dementia with Lewy bodies or Alzheimer's disease. They're looking at these heart rate variability metrics at the MCI stage before the patients had advanced into their dementia with Lewy bodies and Alzheimer's group. And they were looking at different parameters of heart rate variability. And almost all of the parameters of heart rate variability they looked at were significantly reduced in patients with that later on went to develop dementia with Lewy bodies as they're looking at SCNN. Remember, that's our time domain, and they saw that the dementia with Lewy bodies group had a reduced heart rate variability based on SCNN. They also looked at total power and saw reduction in total power, so not as much vagal activity occurring. And then when they looked at the low frequency band and high frequency band, they saw reduction in both of those as well. So not really a shift towards sympathetic or parasympathetic like we've seen in PTSD or in depression, but here just an overall reduction in vagal tone. And what they're concluding, and really for the first time, is that heart rate variability can facilitate differential diagnosis at a mild cognitive impairment stage, which is huge. It's very difficult. It can be very difficult to make a differentiation between different types of dementia, especially at the MCI stage, where you know that something's going on, but you can't really tell what direction it's headed in. And without doing really invasive neuroimaging, expensive time and finances, and referring out, it can get really complicated. And so it's really exciting that this study demonstrated essentially for the first time that this non-invasive tool that's actually looking at the heart instead of the brain can facilitate this differential diagnosis at this early stage. So then you have the opportunity to implement a treatment plan that makes sense for the patient, because treating somebody with dementia Lewy bodies at the MCI stage is different than treating somebody with Alzheimer's at that MCI stage. So heart rate variability certainly affects the brain and what's going on there. And it also is reflected in neurodegenerative diseases. All right, so talk about heart rate variability and a little bit about how they're involved in different types of patients. It's a great biomarker because it's non-invasive and relates to a lot of different disease states. Of course, that is a challenge because then it's not specific to any disease state, but it's a really useful tool, especially when you're using it in conjunction with things like the EVOX assessment and like all of your behavioral screeners that you're doing, different biochemical labs as well. So now you have this biomarker, and maybe your patient is shifted towards sympathetic activity and has a really depressed SDNN, and you're like, okay, great. Well, I want to correct this, and I feel like correcting this could lead to an improvement in symptoms, but how do I do that? Now, there are ways to do it through supplements. Things like CoQ10 and Neo40 are great options, but really, there's a lot of research backing this up. Heart rate variability biofeedback is a way to teach the heart to function in that sine waveform, that smooth waveform, increase coherence between systems, and enhance overall cognitive functioning. So biofeedback is the process of training and active balancing between the sympathetic and parasympathetic branches, and it's shown to improve or increase heart rate variability in terms of SDNN and also balance out that total power distribution. So it's in the balance zone rather in the sympathetic or parasympathetic zone. And it's applicable for a wide variety of conditions. I kid you not, from asthma to depression to IBS. Here on the right is listed a whole slew of things, and that's not even an exhaustive list. And it's been really well studied for a lot of these things. Definitely not enough time to get into all of them today. Now, it has begged the question of, wow, it's quite an effective treatment intervention for so many different things. So what is the mechanism going on here? And there's still a couple kind of working hypotheses, if you will. The most dominant one was that heart rate variability biofeedback is strengthening the homeostasis in the baroreceptors. And then more recently, I would say in the past decade, the hypothesis has kind of shifted toward this vagal afferent pathway strengthening to frontal cortical areas, because we do know that, remember, all of those ascending vagal nerves from the heart to the medulla and all the way up to those frontal cortical areas, 80% are afferent, ascending, as opposed to, 80 to 90 actually, and as opposed to coming back down in an efferent or descending way. So certainly biofeedback training on the heart affects the brain, affects the way it functions, and affects patients and behavioral symptoms. So I want to talk just a little bit about some health outcomes that occur after biofeedback training. And I'm going to keep it fairly general because, like I said, there are so many different disease states that this is pertinent to. It's much more than we can get into now, but I just want to talk generally about some measurable objective outcomes that are really cool. So in this study, it was just a pilot study, 28 participants, so not a ton, but they were taught self-regulation techniques and practiced heart rate variability biofeedback daily for just 1 month. And daily, I think it was about 10 minutes, so not a long time. And after 1 month, the study saw significant changes in hormone balance. And really what they saw was a mean increase in DHEA of 100% and a mean reduction in cortisol of 23%. Now, that's really impressive. Remember, DHEA is the hormone that the adrenal glands secrete to help you handle stress. And of course, cortisol is our stress-inducing hormone. So we're seeing an increase in DHEA that helps you handle stress, that helps you be more resilient, and a decrease in cortisol. And so much to the point that really, I mean, when you look at the numbers like this, you think that this is a pharmaceutical intervention. You think it's a pill that these patients are taking to affect these cortisol levels. But it's just training the heart to be in a coherent state, to balance out that autonomic nervous system activity and enhance SDNN overall, enhance heart rate variability. And not only is this affecting hormones after just a month, but this study also was looking at changes in emotional health and the patient's perception of stress and anxiety, and they saw improvements in those domains as well. So it's not just hormone balance, it's also feeding into behavior and emotional well-being and the patient's perception of their health. So really powerful. For just 1 month daily of this biofeedback training can literally affect hormone levels that are occurring naturally. And that's really exciting too, because when you do prescribe a pharmaceutical, it's like giving somebody a Tylenol when they're sitting on a tack. Like, they might not feel it anymore, but the tack is still there. There's still a problem that exists. And doing something like this, teaching the heart to be in a more coherent state, for the autonomic nervous system to work in coherence with those opposing sides, and to really enhance cognitive functioning overall, that's removing the tack altogether. So really exciting stuff with biofeedback and hormone balance in the body. And they've also looked at blood pressure. This study was looking at a group of hypertensive patients. The first group was a group of patients that was already on hypertensive medications, and they had an intervention of biofeedback training. Second group wasn't on medications, and they did biofeedback training. And then the third group was on medications, and instead of biofeedback, they did a relaxation technique. And then looking at systolic and diastolic blood pressure, and as well as mean arterial pressure, they saw a difference between this biofeedback groups of 1 and 2 versus the relaxation technique. And really, they concluded that heart rate variability training was associated with a significantly greater reduction in mean arterial pressure in the 2 groups who used the biofeedback intervention as compared with the relaxation plus medication group. And I do want to point out that the group not taking medication that used the biofeedback intervention had a significantly greater reduction in systolic blood pressure compared to the relaxation plus medication group. So here, even though they weren't on medication, biofeedback was a more effective tool to use to reduce that systolic blood pressure compared to a group that was on medications and doing relaxation techniques. So true physiological changes in the body happening after this biofeedback intervention occurred. And I do want to talk about cognitive processes. I know that we haven't been classically trained in heart rate variability. A lot of us haven't. And it can sometimes be difficult to wrap the mind around the idea of the heart and the way the heart beats and how that is affecting cognitive processes. Unless, of course, I mean, there are day-to-day examples where you can understand it when you're really heated up in a conversation and you say something that you shouldn't have, and just a couple moments later you think back, wow, I can't believe I said that. Well, that's cognitive processes were inhibited, and certainly the autonomic nervous system and emotions affecting overall cognitive processes. But in an experimental way, in a treatment way, it can be difficult to think about heart rate variability and is that really related to my patient's memory loss concerns? So I wanted to talk lastly today about some studies that were done with heart rate variability, biofeedback training, and cognitive processing. So this first one was looking at a group of 30 participants, healthy controls, and they were selected for their ability to maintain coherence. So maintain that psychophysiological coherence we talked about at the beginning, really thinking about calm, appreciation, good, positive emotions like that. And they already knew how to do this. They already knew how to get their heart to be in a state of coherence. And they performed an auditory discrimination task at the beginning of the study. And then the experimental group did 10 minutes of maintaining this coherence, and a control group did 10 minutes of relaxation. I do want to note there is a difference between the heart in coherence and the heart in relaxation. And there's a great group called the HeartMath Institute that talks a lot about teaching patients how to get into this coherent state. There's also wonderful, it's not really even a study, there's a long paper, kind of like a thesis by Roland McCready, who's sort of the godfather of this heart rate variability field and research. It's called The Coherent Heart. It came out, over a decade ago now, but still very relevant to the field. That does a great job of kind of summarizing all the different ways that you can establish coherence, and also different studies that have been done on how it affects cognitive processing, different disease states, etc. Definitely check that out if you're interested in learning more. But anyway, getting back to this study. So they had patients do 10 minutes of coherence or 10 minutes of relaxation, and then they performed this auditory discrimination task again. And I want to note that this auditory discrimination task is really requiring a lot cognitively. It's requiring focus, attention, accurate discrimination, quick and accurate reactions. So it's certainly relevant for cognitive processing. And what they saw is in the experimental group, after just 10 minutes of maintaining a coherent state, they saw a reduction in 37 milliseconds, which is huge when you consider the control group stayed the same, 0.4 milliseconds of a difference. Literally almost exactly the same. So huge reduction in this auditory discrimination task, huge improvement, boost in cognitive processing ability in this auditory discrimination task after just 10 minutes of coherence. So a great study, even though it was a small sample size, but really demonstrating so clearly that coherence in the heart, kind of tweaking that heart rate variability, has the ability to really powerfully affect cognitive processing. Now, another pilot study that was done in the UK was looking at participants that underwent a really comprehensive battery of cognitive performance tests. This group in the UK does a lot of pharmacological testing for big pharma. And so they're calling it the Cognitive Drug Research Measurement System. Basically, all of these cognitive tests, a battery that they do every time they're testing pharmacological drugs that are supposed to enhance cognitive processing. And they had patients perform biofeedback for 7 weeks. And then they did this battery of testing again. And what they saw was that the quality of episodic memory was increased, an average gain of 12% in the quality of long-term memory. And they also saw the quality of working memory increase, although not quite significantly, but still a small increase that's notable, but certainly an increase in episodic memory just after doing biofeedback for 7 weeks. Now, it is really interesting to note that the authors, they note that the magnitude of improvement here in episodic memory and just overall cognitive processing was significantly higher than the improvement they saw in the quality of memory obtained after a large clinical 14-week trial that the same group performed to study the effects of a phytopharmaceutical memory enhancer. I think it was some type of a ginseng ginkgo combination. And so they basically say at the end of this publication that, not only did this biofeedback therapy enhance cognitive processing, enhance the quality of memory, but it did it better than a true pharmaceutical intervention that they had studied. So really exciting, and again, demonstrating that There's no doubt about it. Lots of great health outcomes can come from training heart rate variability. And tons more that you can read on health outcomes for specific patient types. It's really great when you're treating depression, PTSD, ADHD, mood disorders, even sleep disorders, chronic pain, really all of the above. It's a fantastic tool and it's really accessible, which we'll get to in a minute. But a quick summary before we wrap things up. First is that heart rate variability, as you now know, reflects heart-brain interactions and autonomic nervous system dynamics. Remember, it's heart-brain interactions. The heart sends more signals to the brain than the brain sends to the heart on that parasympathetic side. So certainly a lot of heart-brain interactions going on. And we can analyze heart rate variability in a time domain and a frequency domain. And these metrics are psychophysiological biomarkers of a number of different disease states. So not specific to one disease state, but really applicable to a whole slew of different types of patients, different symptoms that can give you insight, sometimes to facilitate differential diagnosis, sometimes to really guide a treatment plan. Maybe it's not anxiety manifesting in the brain. Maybe it's anxiety manifesting in the autonomic nervous system, and that's where we need to correct. And we talked about how heart rate variability biofeedback is a proven treatment intervention for a lot of different disease states, and it can be beneficial in promoting homeostasis in healthy populations. So personal anecdote here, my father, I actually prescribed biofeedback therapy to, and I use the word prescribed kind of literally because it's like homework. It's like taking a pill, but instead of taking a pill, it's teaching your heart how to correct this coherence on its own. And it, he has no true diagnosis of any mood disorders, but certainly struggles with anger issues and kind of gives you that walk on eggshells type of feeling sometimes. And training in biofeedback has made a huge improvement and has also increased or improved his overall heart health biomarkers, which was a concern at some point just for possible myocardial infarct risk. So a great tool, not just for patients that have true diagnoses for pathology, disease states, but also for homeostasis in healthy populations. All right, so of course, in your practice, you want to know how can you do it, what can you do about it? Like I said, there are some supplements that help with heart rate variability, overall heart health, things like CoQ10 and Neo40, but remember the tack. Sometimes that's just, it's creating good things. It's always a good thing. It's not going to hurt, but it's also not really correcting the problem at the source. And heart rate variability is a great way that you can do that. Now, the EVOC system can do heart rate variability biofeedback training, but that requires your patient to come into your office, and sometimes that's what it takes for the patient to take it seriously. But sometimes you can prescribe it as homework. And I do mean prescribe. It's like a pill. You're prescribing 10 minutes a day for a month, and then we'll see how things change. And a great tool for that homework is we usually refer to HeartMath, which again, that HeartMath Institute, they're really kind of the leaders in this field, and they have a really great tool. It's like $100 that your patient can buy and take home and do heart rate variability coherence training on their own. It's biofeedback. It lets them know when they're in a coherent state versus when they're not. Doing that biofeedback training. And again, let's go back and talk about some of the studies. I mean, cortisol reduction, DHEA increase, blood pressure reductions, all of these really great things, memory improvements that can happen just from training, and not even that long of a period of time just from this biofeedback training. So that's just a little bit about heart rate variability biofeedback and heart rate variability in general, what it is, how it can be used in your practice, how it relates to your patient's health and clinical utility. So if you have questions, definitely shoot them my way. I'm happy to follow up with you after the presentation. Thank you for joining and bearing with me for those technological challenges. I hope I'll see you again next month for our next Lunch and Learn. And thank you all. Have a great day.